And that brings us to the end of this week's Prime Minister's Questions, the last one before Christmas. Let me welcome our guests. Here in the studio, Gillian Keegan for the Government, Apprenticeship and Skills Minister. Welcome. Liz Kendall, who is there. There she is. Shadow Health for Labour, and Laura Kunsberg, the BBC's political editor. Welcome to all of you. Unsurprisingly, Keir Starmer obviously talking about the tiered system and also the rules or relaxation of those rules over Christmas. Now, just before Prime Minister's Questions, there was news breaking that had been agreement. There isn't going to be a sort of massive change to those 5 days between the four nations. Can you bring us right up to date?
That's right. So the four nations had their second conference call this morning to agree this. They have resolved that no one is going to change the law. You know, there was a lot of effort that was taken to try to stitch together this agreement where people from different parts of the UK could move around the country if they really wanted to. What there will be, though, in the coming days, and we heard it there from the Prime Minister, is a real kind of sobering up of the advice, if you like, from the politicians in every corner of the UK. Yeah, and I think actually there's going to be a big public information campaign as well that we'll all probably get very familiar with hearing, saying, yeah, you can do this. People are not going to be criminalised if they do go safely to go off and see an elderly relative or someone that they haven't seen for many months over the Christmas period. But think before you do it. Try to stay local if you can. Take care. Think through this. This is absolutely not meant to be a free-for-all. But the dilemma here for politicians has been really, really clear. They made this promise to the public that things would ease off a bit. People made plans. And now, of course, the virus in lots of parts of the country has really gone the wrong way. Now,
you say there's not going to be a change in the law, but let's just show our colleague's tweet here, Nick Eardley. Now, he's saying the Welsh Government is urging people to limit the Christmas bubbles to 2 households. We've understood it's 3 that can mix. It's advice and not law, not expected to change, but reflects concern about rising number of cases. So they've tweaked it.
So they are tweaking the advice in Wales, and I think they will tweak the advice. Let's just be clear with the audience. There's what's been put into law and legislation here, and then there is the public health advice and the messaging that we will hear. And it's right with the particular position in Wales. The First Minister, Mark Drakeford, is saying to people, we don't think it's a good idea to get 3 households together. The situation in Wales is particularly precarious, and more importantly, actually, than the Christmas relaxation, he went on to say that actually from the 28th of December, Wales as a nation is going to go into what they're calling Tier 4.
Right.
Which is basically another lockdown in Wales.
Right, so that's quite big news
it's
there.
Very big news for our viewers in Wales today, yeah.
OK. I mean, listening to all of that, Gillian, do you think a combination of rising infection case rates in vast swathes of the country in England and a relaxation of the rules for 5 days over Christmas will be in lockdown in January, won't we?
Well, I mean, there's no easy way to navigate this, right? We know what we're dealing with. We've got, you know, a highly infectious virus, which it appears has become even more infectious, one variant of it. A third, at least, of the population asymptomatic. We've now got these rising cases. It could be down to this new variant or it could be down to other reasons. And yet, you know, you've got to choose and navigate between these sort of bad options with the economy, what to do to protect the NHS, and Christmas and winter. That's effectively what we're dealing with. And we're trying to get that balance all the time.
But we could end up in lockdown in January like Wales.
Well, what we've said to people, and I agree, you know, it's the legal limit that's there. And I think what we'll be stressing to people is, and I think anyway, people are really very concerned about their own elderly relatives and their own loved ones and will be taking care. Many people already are saying, look, we'll wait until our elderly relatives are vaccinated. But, you know, what we're saying is really, with these rising cases, be really careful what plans that you do and do something that keeps you and your loved ones safe.
All right.
You know, protect others, sanitise, hands, face, space, self-isolate a few days before as much as you can. Take as much precaution as possible because there is no doubt we can't get away from it. The cases are rising and certainly in London, we've just
Which is why, of course, people will think it's very strange then that there is going to be this relaxation. But we'll come back to it in just a moment. Liz, Keir Starmer said it will be Boris Johnson's next big mistake in terms of that relaxation. So can we understand from that he would actually like there to be a reversal in principle of that?
I think we would definitely like the government to convene COBRA, look at the evidence again. And I think what's interesting about what Gillian's just said and Boris Johnson's answers in the House of Commons today shows the fundamental problem the government has had is that they think that it's a zero-sum game between the health restrictions that may need to be put in place and what happens in the economy. The truth is it's not. unless you get the health strategy right, you are going to cause further problems in the economy. That's my concern about next year. Everybody is desperate for 2021 to be better than 2020. We know the vaccine is coming along. That's brilliant news. But what we don't want to do is risk more death and actually us going into a further national lockdown, which would be the worst possible thing for the economy. And that's my fear about the government's current approach. Too slow. You know, it's all very well now, 3 weeks after the Christmas announcement, to start talking about people and what they should do. You know, for 3 weeks, all we've had is Boris Johnson saying we need a jolly careful Christmas. I'm afraid we need much more than that.
Okay.
So I just think this is another example of him being too slow and failing to understand you've got to get health and the economy. They go hand in hand.
Gillian?
That's exactly what we do understand. They do go hand in hand. But, you know, clearly you've got to get a balance of things. And we have been, well, every country around the world has been wrestling with this balance. But what we've said is, you know, we did want to have some time for families. It's been a tough year. And you know, there are families in terrible situations that, you know, they want to spend a last Christmas with a loved one.
I know, but when you listen to the Chief Medical Officer
different...
and the Chief Scientific Officer, and we hear time and time again from the government and Boris Johnson that they are following the science, they are following the advice, and they are at pains to say it's hugely risky.
I think everything that we do has got a lot of risk attached to it when you've got a very infectious virus with so many people asymptomatic. That's why the mass testing, as well as the vaccine, is actually another important step. But the reality is you have to choose. You know, it's very easy if you don't have to choose. And, you know, obviously the opposition have the luxury of that position. We have to make those difficult choices. We've had to make the difficult choices to close, you know, restaurants and in London in December and Christmas. You know, it's a very difficult choice. And they're unenviable choices in a way. What we're saying is we would like to give people the opportunity to see their family without being criminalised over Christmas, and that's what we're trying to do. But please be careful with that opportunity.
Just to give you a flavour, we've just heard from Nicola Sturgeon how she's presenting it this lunchtime. She said that the conversations with the other nations are ongoing, but this is how the Scottish Government is going to advise people to act, not changing the law, but suggesting that meetings indoors should be limited as much as possible. She said she would recommend people meet other households for only 1 day out of the 5-day Christmas period and should not stay in someone else's home overnight unless it can't be avoided. She also said they'd be recommending that people didn't travel from high risk to low risk areas. So interesting there that we're hearing from Mark Drayford already, then from Nicola Sturgeon. I think we may hear also in detail from the Prime Minister later today about exactly how they want members of the public to act within this legal framework.
Because you don't have to, of course, take up all this advice.
Well, no, of course you don't. I mean, but we've gone from a position where at the start you had the Prime Minister saying it's the season to be jolly and jolly careful, and politicians saying things like, just because you can, it doesn't mean you should, to a much stronger set of advice saying, look, we're not going to lock people up who've made arrangements to try to see people over the Christmas turkey, but we are saying to you, basically, don't do this unless you feel it's very, very necessary. Interesting also, someone in government said to me not long ago, their private focus groups were not telling them that people were clamouring to do this.
I know.
They were still showing, and as many of our viewers might feel this lunchtime, a lot of people were looking at this with very real concern.
Right. I mean, I'm sure that's true. There is anecdotal evidence to support that as well. Liz, would you like to see that sort of advice that you've just heard Nicola Sturgeon, obviously, publicising in England?
I would like to see stronger advice here. Look, I can remember when the Christmas rules were announced 3 weeks ago, talking to my local Director of Public Health in Leicester. And as you know, we have been almost in permanent lockdown since this pandemic began. Really worried about that. Really worried about the prospect of households mixing and what that would mean. I know in my own local hospitals, we are, you know, already above the peak where we were at the peak of the pandemic. We're still doing operations. We haven't had to cancel those yet. But I understand today some London hospitals have been saying to their MPs, actually, we are starting to cancel operations. So people who may have something that they really need doing in a hospital having to miss out because there's so many COVID patients in there. So I would like to hear some stronger advice. I think it should have happened weeks ago. And I do think, you know, when a situation changes, the government does need to change, because if we have a third national.
Right. But are you saying scrap it? Are you saying scrap the relaxation then?
No, I am saying
Right.
what I'd like is for the government to have a COBRA meeting, reduce that. Because what I want a better 2021 with families being able to meet up, vaccinating, mass testing and so on. My worry is that we are currently on a trajectory for our hospitals to hit the peak on New Year's Eve, and that would be the worst possible start for the new families and businesses.
Well, you mentioned your constituency and your area because we're going to hear the first review of the tiered system of restrictions, probably later on this evening. Maybe they're going to be announced formally tomorrow. Is it working where you are, Liz, the tiers?
We've seen our rates are actually coming down from where they were previously. We're still very high. We've still got problems with all the contact tracing. We've only just been able to get that local tracing that we've been asking for. Our success rates locally are much better than the national system of contact tracing.
So are you crossing your fingers for a movement in the tier for you?
I think that that's unlikely for Leicester because of where our rates are. We're still way above the national average. But what I would say is we have got to still get that contact tracing and mass testing right.
OK, well,
there's still problems there, and I hope the government will move on that.
Well, if we've got time, we're going to talk about some of the testing and the announcement yesterday by Gavin Williamson about testing in schools from January. But one of the things I wanted to pick up with Fact Check Joel is this statement from Boris Johnson that huge amount of progress has been made in bringing down infection rates. Where's the evidence for that, Joel?
Hi, Joe. Yes, as you say, there was this debate about what's been happening in terms of cases going up or down in areas in different tiers. So just to give you the overall figures first, this is UK government data for England, and it's the latest BBC analysis of that data. So of the 315 local authority areas in England, there are 69 areas where rates went down, and there are 246 areas where rates went up. I should say this is the weekly case rate for the most recent week compared with the week before. Keir Starmer mentioned specifically Tier 2 and also Tier 3. For Tier 2, there are 26 areas where rates went down or stayed flat, and 121 areas where rates went up. And then in terms of Tier 3 areas, there are 43 areas where rates went down and 123 where they went up. So whether you look at the whole country or Tier 2 or Tier 3 specifically, the picture is that rates on the whole are going up.
Right. It's not working, is it, Gillian? Huge progress isn't being made. The figures just bear it out.
Well, I mean, what you say, this concept of working is to try and suppress the cases against what they otherwise would have been, which is the counterfactual you never actually know, right? So what you're trying to do...
but they're going up. They're going up. That's the whole point in the majority of local authorities in England. Yes,
they are going up, and that's why we've now put more areas into Tier 3. That's why we have the tier systems in place to be able to try and do that. Now, what that puts... All of these basically all of them are designed to reduce the amount of socialising through households, through places you can go. And all of those do have an impact to some degree. Obviously, nothing works like a total lockdown because then nothing's open, you can't go anywhere,
but would you be
nobody
worried,
can
Gillian,
mix.
Looking at those figures, would you be worried to hear that the majority of all of them, and even if you break it down in Tiers 2 and Tier 3, so Tier 3 with the toughest restrictions, the majority of those local authorities, they are seeing weekly case rates continuing to go up?
Yes, I am. Of course, I'm worried about that. Everybody's worried about that. And I think there's a couple of things. One, what makes me hopeful is the vaccine and the mass testing. And what also I think contributes...
but not the tiered system.
What's contributing to this, and we don't know how much it's contributing to this, is this new variant that is apparently even more infectious, that is apparently transmitting even more within younger people. So there are these things happening. We're dealing with a virus that, is mutating to some degree. Now, obviously, they're testing that at Porton Down, and there's no, there's no...
Well, there was a bit of criticism of Matt Hancock coming to the House so early to talk about this variant. In fact, from Jonathan Ball, we had him on yesterday, the virologist from Nottingham University, saying he was perplexed, let's put it that way, when they didn't really know enough about the variant.
I think that's right, but also, as I understand it from government, there's a responsibility on governments to declare things to the World Health Organization. So I know that there were sort of eyebrows eyebrows raised, and there was, I suppose, there was a gap in the day as well, because the Health Secretary mentioned it in the House of Commons, and it wasn't until a couple of hours later that we heard then from Chris Whitty at a big press conference who talked about it from a clinical point of view. So I know that eyebrows were raised about that, but as I understand it from government, there is a responsibility on governments to report these things. But I'm sure the professor you had on yesterday will be much better versed in all of this. But I think more broadly, look, I mean, if we forget about the Christmas relaxation for a few days, I think the debate that we've just had between Gillian and Liz, this debate about the management of this pandemic is absolutely going nowhere. This is going to be with us for the next few months while the vaccine is rolled out. Of course, everybody hopes that happens as quickly and as smoothly as it can. I think 180,000 have happened in the first 7 days. But this whole political dilemma has still a long way to run. And this almost agonising balancing of people's livelihoods, other kinds of treatment on the NHS, which we know is really backed up, particularly in some areas of the country.
And we've still got the busy months ahead, haven't we?
We still have the busy months ahead. And I think that if we come to look at this period in a few months' time with the benefit of hindsight, it may well be the criticism of the government that the NHS is always under intense pressure at this time of year. Was it then correct to be trying to carry out a relaxation in sort of late autumn, winter, when people always knew that sort of winter pressure was in the diary, if you like?
OK, well, look, Liz, we haven't got very long. Would you like to see a Tier 4? I mean, we've just talked about the tier system. We've seen the figures. We've had them read out to us. The case rates, weekly case rates are going up in most of them. Would you like to see a higher tier?
No, what I want to see is, because I think people are desperate for something practical, what's the best way forward? Firstly, I want local directors of public health to have control of the contact tracing. As I said, we've got much better success rates, over 90% when we do it locally, compared to as low as 40% when it was done nationally. Secondly, we have got to ensure that people who've been in contact with someone who's tested positive can self-isolate.
OK.
We have seen it let me just finish this point.
Yeah, go on. You haven't got long.
Care homes that pay full pay when people are off sick because they're self-isolating or have the virus have much lower rates of infections. So I think there are practical things that we need to get right if we're going to see a better 2021, which is what we all want.
All right, well, as I said, we heard that announcement yesterday. We're almost at the end of the show about the testing of secondary school pupils in England will be greatly increased in January. We didn't have time to talk about the efficacy of it. That will be for next time. But from all of us here, bye-bye.